Advanced hair growth cycle and initiation. 1. Quick overview. One-line summary. Hair growth cycle में 4 main phases होते हैं: anagen, growth, catagen, involution, telogen, resting, exogen, shading. Scalp hair में ज़्यादा time anagen में रहता, 2-6 साल, फिर short catagen, 2-3 weeks, फिर telogen, 2-3 months. Normal scalp में 85-90% follicles anagen में रखे हैं. 2. Follicle anatomy. क्या कहा होता है? Layers and locations. Short map. याद रखने लायक. Epidermis. ऊपर की skin. Infundibulum. Sebaceous gland का opening. Pore से ऊपर का part. Isthmus. Sebaceous gland से niche तक का mid part. Bulge. Stem cell niche. ISI area में होता. Lower follicle bulb. Dermis के अंदर. यहीं से hair shaft बनता. Hair bulb. Center में dermal papilla. DP. Specialized mesenchymal cells. DP के चारों तरफ matrix keratinocytes. Rapidly dividing. Plus melanocytes. Pigment. Outer root sheath. ORS. And inner root sheath. IRS. Follicle को surround करती है. Hair shaft. बाहर निकालने वाला cuticle. Outer. Cortex. Main bulk. Keratin rich. Medulla. Center. Sometimes present. 3. कौन से cells important है? Short. Bulge stem cells. Quiescent epidermal stem cells. Anagen start में active होते. Hair germ transit amplifying cells. Bulge से descent का matrix बनेत. Matrix keratinocytes. Bulb में divide का shaft बनेत. Dermal papilla. DP. Signal center. Growth factors बनाता. Blood vessels से close. Melanocytes. Pigment produce carti. Hair color. Endothelial cells. Capillaries. Adipocytes. Fat cells. In hypodermis. Immune cells. Tregs. Macrophages. Microenvironment control. 4. Hair cycle. Detailed. क्या होता है हर phase? Anagen. Growth. Matrix cells rapidly proliferate, hair shaft बनता and push होता up. DP से signals milt. Anagen duration decide करता hair length. Catagen. Involution. Programmed cell death. Apoptosis. Of lower follicle. Follicle shortens. Bulb moves up. Ye tilde 2-3 weeks. Telogen. Resting. Follicle quiescent. Hair attached but not growing. Tilde 2-3 months. Hair may be shed during telogen. Telogen effluvium agar bahut follicles prematurely आये तो heavy shading. Exogen, shading. Active release of the club है. Anagen next cycle से पहले हो सकता है kenogen, temporary empty phase. 5. Anagen initiation, step-by-step mechanistic flow, सबसे important part. ये वो sequence है जो thelogen follicle को wake up करता और नया growth शुरू करता. Trigger, systemic local seasonal cues, hormones, metabolic state, local injury mechanical stimulation, growth factor surge, adipose skin signals. Dermal papilla activation, DP की gene expression badalti, DP से pro-growth factors, WNT ligands, FGF, IGF, PDGF, VEGF, release. DP के पास capillary loop रहता, angiogenesis helpful. BMP signaling downregulation, BMP pathway, inhibitory, काम हो जाते, is stem cells activate होने लायक हो जाके. WNT beta-catenin upregulation, WNT signal bulge है germ में activate होते beta-catenin nucleus में जाके proliferation genes on CAR-T. ये anagen के लिए बहुत critical, go, signal है. Hair germ cells proliferate, bulge के nearest progenitors, hair germ, पहले divide CAR-T, फिर bulge stem cells भी participate CAR-T. Matrix formation, rapid proliferation से new matrix forms around DP hair shaft plus IARS start differentiate होना. Angiogenesis, new capillaries via increased blood flow DP को nutrients oxygen deca growth को sustain CAR-T. VEGF important. Melanocyte activation, अगर hair pigmented है तो melanocytes को भी activate करना पड़ता वरना new hair gray white. Keratinization and cross-linking, shaft band par keratin proteins crosslink, disulfide bonds, mechanical strength. Anagen maintenance, continuous DP-derived signals plus sufficient nutrition hormonal milieu maintain hota hai jab tak anagen period khatam na ho. 6. Key molecular pathways, short and what they do. WNT beta-catenin, activation is equal to anagen start hair follicle morphogenesis, very important. BMP, bone morphogenetic proteins, inhibit activation, downregulation needed for anagen. SHH, sonic hedgehog, promotes proliferation and follicle downgrowth. FGFs, ESP, FGF7 KGF, FGF10, promote keratinocyte proliferation. IGF-1, promotes growth and survival of matrix cells. TGF-beta-1, promotes catagen, involution, in many contexts. Notch, differentiation signaling for IARS-ORS. Prostaglandins, PGD2, inhibitory, linked to balding, PGE2 PGF2 alpha, pro-growth. Androgen DHT, in genetically sensitive follicles, androgenetic alopecia, DHT shortens anagen and causes miniaturization. 7. Blood supply, nerves, adipose, ECM, microenvironment details. Capillaries, DPK Baha capillary loop closely wrapped, oxygen and nutrients directly support matrix. Adipose, hypodermis mature adipocytes release cytokines, DFA etc. that support anagen onset. Subcutaneous fat thickness correlates with follicle cycling. ECM, collagen, laminin, fibrontin, and integrins, matrix remodeling, MMPs, needed for follicle movement and growth. Nerves neuropeptides, substance P, CGRP, can modulate inflammation and follicle behavior. Chronic stress increases substance P negative effects. 8. Nutrition and systemic factors. What specifically helps anagen? Protein and amino acids, keratin rich in cysteine and methionine, sulfur amino acids needed for disulfide bonds. Iron, iron deficiency thelogene effluvium, iron needed for cell proliferation and enzyme function. Zinc, hair matrix cell division, keratinization, deficiency causes shading. Vitamin D VDR, receptor important for hair cycling, low vitamin D associated with hair disorders. B complex, biotin, true deficiency rare but causes hair fragility, biotin supports keratin infrastructure. Essential fatty acids, omega-3-6, membrane health, anti-inflammatory. Thyroid hormones, hypothyroid, hyperthyroid both disturb cycle thelogene other changes. Glucose insulin status, metabolic syndrome insulin resistance can influence androgen metabolism and hair. 9. Immune and inflammatory modulators. Regulatory T cells, TREGs, support stem cell activation and protect follicle. Pro-inflammatory cytokines, IL-1, TNF-alpha, inhibit growth associated with thelogene effluvium or scarring conditions. Autoimmune attack, alopecia areata, T cells target bulb anagen interrupted, patchy hair loss. 10. External and mechanical effects. Traction chronic pulling, miniaturization, scarring, traction alopecia. Chemical heat damage, cortex keratin damaged hair breaks, not true anagen stop but shaft loss. Topical medications procedures. Minoxidil, vasodilation, KATP channel opener, prolongs anagen and may upregulate VEGF. Finasteride, systemic 5-alpha reductase inhibitor lowers DHT, male AGA. PRP, microneedling, LLLT, stimulate DP, growth factors, WNT signaling, support anagen. Prostaglandin analogues, egbimatoprost, can promote growth in lashes, scalp use experimental. 11. Common pathologies that block anagen, short notes. Androgenic alopecia, AGA genetic sensitivity to DHT shortened anagen plus follicle miniaturization. Thelogen effluvium, stress illness drugs cause premature catagen widespread thelogen and shading till 2-3 months later. Anagen effluvium, cytotoxic chemo immediate matrix arrest and hair falls quickly. Scarring alopecia, inflammation destroys bulge stem cells permanent loss. 12. Timeline and numbers, useful facts. Scalp anagen, 2-6 years, determines hair length. Catagen, till 2-3 weeks. Thelogen, till 2-4 months. Normal shading, till 50-150 hairs day, varies. Scalp follicles in anagen, till 85-90%, thelogen till 10-15%. 13. Practical checklist, how to support anagen, actionable. Ensure sufficient protein and sulfur amino acids, eggs, meat, pulses. Check and correct iron, zinc, vitamin D, thyroid if abnormal. Avoid chronic traction, harsh chemicals, limit heat. Topical minoxidil for androgenetic thelogen cases, if appropriate. Consider microneedling PRP-LLLT, clinical settings, to stimulate DPWNT. Manage stress, neuropeptides plus cortisol affect cycle. Treat scalp inflammation dandruff promptly, reduce cytokine burden. In male AGA consider finasteride after consulting doctor. 14. Tiny but important details, chote bake. Bulge location is equal to isthmus, below sebaceous gland, Yahi stem cells repair epidermis 2. Hair germ is equal to immediate progenitors activated first, before bulge. Kenogen is equal to gap after shading before next anagen starts, temporary empty follicle. Melanogenesis timing. Melanocytes must be activated in synchrony with matrix or hair will be gray. Disulfide bonds formed during keratinization in cortex determine tensile strength and heat chemical resistance. Regional differences, beard, eyebrow, body hair have much shorter anagen, hence shorter hair length. 15. Summary. Anagen start in 6 simple steps. Cheat sheet. DP senses trigger secretes pro-growth factors. BMP signal reduces. WNT beta-catenin rises in hair germ. Hair germ divides, bulge stem cells join. Matrix forms around DP rapid proliferation. Shaft and iris differentiate. Melanocytes activated. Angiogenesis plus nutrients maintain growth until programmed stop.